Hi, I'm Dr. Julie Steinauer. I want to talk about an actual serious topic today. One is visual neglect or visual spatial neglect versus what is homonymous hemianopsia. Kind of a crazy phrase. But visual field neglect is whenever someone has a traumatic brain injury that causes them to have lack of attention from one side of their body. So let's say that the trauma occurred on the right side of the brain and they would have a left-sided neglect, which might mean they might not shave on one side, or they may not put makeup on one side, or they may be sloppy on one side, not noticing there's things on their glasses where this side is taken very well care of. So that's a visual spatial neglect, but a homonymous hemianopsia is where the brain has had an injury due to some sort of trauma or stroke in which you lost the visual field for each eye in a certain area. So for instance, if it's a right hemianopsia, you lose the right field for your right eye and the right field for your left. If it's a left hemianopsia, you use the left field and the left field for the right eye and for the left. And so it's the same in both eyes. You lose a portion of the field, like it's just missing. So you can imagine if someone is missing their visual field, suddenly they don't know if it's on the right side that they lose it, then they might run into things on the right side. If it happens to be on the left side, the same thing could occur. In settings where there's a lot of people around and it's super busy, they may have difficulty moving around and walking around. They may even knock things over and be klutzy and clumsy where they never were before because of the visual field loss. Okay, so there's visual neglect versus the visual field loss. Now, I want to give you 3 ways that we can talk about how do we actually correct this, and what do we do? What can we do to actually make it better? Okay, and there are 3 things that you can do. In our clinic, we use photosynthetic light therapy, where we electrically change and train the brain to process vision differently and better. So sometimes we can bring back some of the visual field that's lost in like a homonymous hemianopsia. In fact, we can usually bring back anywhere from 30 to 80% of that visual field that's lost, and that's a significant amount. How much is brought back? Well, there's a lot of factors that depend or that are dependent on this, and it could be age. If someone has had this traumatic brain injury and they've had this loss of field for 65 years versus someone who's maybe had this loss of field for 5 months. So sometimes age or time can be a factor, but it also can be the significance of the trauma. And so certain brain injuries are more traumatic than others, and it can cause more difficulty than others. And the second thing that we use, besides the photosynthetic light therapy, where we electrically retrain the brain, is going to be what we call peripheral grounding. So for someone who has lost some of their periphery, they need to get kind of rebalanced with where the periphery is at and where the understanding of that information is at again. And so we teach them how to kind of reground themselves and rebalance their space so they understand this right side on my right homonymous hemianopsia might be gone, and we need to teach them how they're going to move around in the world and get used to that. But as we're using the photosynthetic light therapy to bring the field back, then they have the ability to move into that field better. The third way is that we do what we call massaging the deficit, and that means that if I've got a right field loss, then for each eye, what I'll do is I'll kind of work in that area with a lot of different activities to massage the brain to get used to seeing something over there again. So it's almost like turning the cells on in the brain again to be able to pay attention to this information. Okay, so visual neglect is where it's an inattentive problem. They don't attend to the details of one half of their body, and it comes from a problem on the opposite side of the brain. And then the homonymous hemianopsia occurs in traumatic brain injury or stroke, where they'll be missing the field in the same spot on the right or on the left for each eye. There's something that can be done for both of those conditions. And to learn more information about what we do, go to visionforlifeworks.com. And if you happen to be a doctor or therapist, check out our Next Level Vision Therapy group, which is awesome.